All right, let's get started. My name is Scott Dowell, and I am Deputy Director for Surveillance and Epidemiology at the Bill and Melinda Gates Foundation, and have the privilege of chairing this next session, where we're going to hear about the challenges and consequences of using big data for infectious disease work. Of course, it's not new, nor is it unique to infectious diseases that there are challenges in the use of big data. In fact, yesterday the newspaper ran an editorial in the New York Times about the challenges of big data and the failure of the pundits, the polls, and the big data analytics to accurately predict the results of the presidential primary from this year. The editorial argued that some reporters working on the ground and going door to door and talking to voters actually got it right, and criticized the big data 538 site and others for getting it wrong, and highlighted the importance of what they called shoeleather reporting, which caught my eye because shoeleather epidemiology is what was drummed into many of us at CDC. In fact, the symbol of the Epidemic Intelligence Service, or EIS, at CDC is the sole of a shoe with a hole worn in the center of it, allegedly from walking door to door, neighborhood to neighborhood, collecting the primary data to understand the spread of an outbreak. But I'm with the Gates Foundation now, and we love big data. And we've had really success over the years in investing in big data. You've heard from some of them, the Institute for Disease Modeling, the Institute for Health Metrics and Evaluation that has run the Global Burden of Disease study, which arguably has revolutionized the science of burden of disease estimation worldwide, and has weathered its share of criticism in the course of doing that. Like Nate Silver and the 538 site, the big data in epidemiology sometimes get it wrong. And when that happens, there are criticisms from both sides. 538, when they got some of the election predictions wrong, said, what's wrong with the polling? So the primary data are lousy, and of course we can't model it if the primary data are lousy. On the other side, people say, what's wrong with the analytics? You're trying to model things, you have obscure black box analytics that we can't understand, and there are hidden assumptions in there that are being revealed by your failure to identify whether it's the result of polling or the next epidemic. In the end, the editorial, Jim Rittenberg, who wrote the editorial, said, it's not either or, that in fact, big data science in journalism and traditional reporting are complementary and should be complementary, and they can enhance each other if used well. And I think that's a theme that I'm beginning to hear from this morning's talks. It's certainly something that I believe, and so I'll look forward to our speakers. Let me I'll introduce them in turn as they speak. So first is going to be Michael Edelstein, who's a medical epidemiologist who has a long history working globally on public health emergency crises, and is now with the Chatham House, where he's worked on, among other things, a very important project to encourage the routine reporting of public health surveillance data, especially in the context of a public health emergency of international concern, but also in the context of global public health priorities like the Sustainable Development Goals. Michael's topic is digital disease detection, challenges and considerations. Michael.